Show. Lots of breaking news. 2,382 new cases in New York. And obviously, we have a lot of questions. Americans are apprehensive. I truly am committed to staying informative. We have to have clarity. We have to have knowledge and information. I can't think of anybody better to get that from than our next guest. Dr. Anthony Fauci is the director of the National Institute of Allergy and Infectious Diseases. Of course, for millions, he has been a reassuring voice and face during this difficult time. Dr. Fauci, we're so grateful for you taking some time to join us here on the Mike Gallagher Show. I know our listeners and we appreciate you very much, sir.
It's good to be with you.
Listen, there's so many questions, sir, and one of the big, I know you've been asked a million times, the testing. It's hitting close to home. I saw a report last night in Los Angeles of a man who was giving CPR to his wife, allegedly gave her mouth to mouth. Since he was asymptomatic, they wouldn't test him. I have a good friend who was exposed to two coworkers who have tested positive. When he went to the doctor said, if you're not symptomatic, we're going to hold, this was in New York City, and we're going to, for those who are presenting with symptoms. If you can be a carrier and asymptomatic, shouldn't we be trying to get as many tests done for everybody as possible?
Well, I wouldn't say for everyone as possible, but for someone who clearly has a reason. Some of the restrictions on testing have been actually lifted. There were regulatory restrictions that were just things that were meant in the right context, but they don't apply right now. And that's the reason why the FDA and working with the CDC has lifted some of those restrictions. But rather than look back, look forward. What's happened over the last literally couple of days is that the administration, the president and the vice president have embraced the private sector. The original testing that is done as a public health measure from the CDC worked well for what it was originally designed for the flooding the country and the market, as it were, with available tests that not only are there, but that can actually be implemented. Literally, that's changing rapidly by the day. So right now, the big companies, the people who do it for a living, the people who know what they're doing, are now getting actively involved in things like drive-through availability, walk-through availability, where you go to a place, a market, a pharmacy, or what have you, and you have it available. So it's unfortunate that the people, some of the examples that you just mentioned, were not able to get a test if, in fact, they really needed it. That will change. Now, having said that, you don't really need a test just because you feel like you want a test. If you have a reason, like someone is exposed or someone has symptoms, they should get it. But you're absolutely correct. Up to now, the availability of testing is not where it should have been, but that has changed. That has changed.
Very important, and I'm impressed by watching the speed with which the public sector and the private sector are sort of coming together. Dr. Fauci, you have advised 6 American presidents. Have you ever seen this kind of response to the degree that it's occurring now?
Well, no. Every outbreak that I've been involved with, that I've involved advising presidents as early as my first interaction during the HIV/AIDS epidemic with President Reagan, each has a different flavor to it. What we're seeing now is clearly unique. So I can say, without any hesitation, that this is a unique situation because it's a threat to the entire country. In fact, the entire world. I think if you look, as I'm sure everyone is, at the news reports from what happened in China and what is now happening in Europe, particularly in Italy and in France, that's the reason why we are very actively leaning forward, aggressively preparing and implementing so that that does not happen here. We're going to see increase in cases. So I think our listeners and the entire public should realize that things are going to get worse before they get better. But what we're doing, even though you may not see the results right away, clearly are aimed at and hopefully successfully will blunt the full impact of the outbreak that others have seen in different parts of the world.
I was reading this morning an article over in The Atlantic. Peter Wehner wrote an interview with Francis Collins, the director of the National Institutes of Health, and he told Pete that if nothing goes right and if we fail to flatten the curve, we might see the deaths of as many as 1.5 million people in the United States. He wasn't offering a prediction, but a realistic worst case scenario. Again, we don't want to panic people, but when we look at Italy and we look at the way the deaths have increased exponentially there, we are on an exponential curve, right? And that's why some of these draconian steps are in place.
Well, yes, the draconian steps are in place, and we have to be careful when people talk about best and worst case scenarios. In all of my experience over the years, that does more to panic people than it does to really inform them in an appropriate, prudent manner. When you do modeling, the model is as good as the assumptions you put into the model. So even though the worst case scenario always sounds just completely, in outer space practically,
Right.
it could be really quite serious, but I don't think we should focus on numbers that come out of a model. We should be focusing on what we can do to the best of our ability to blunt the full force of the outbreak. So I tend to shy away from those models because the numbers get taken out of context and it does nothing but frighten people. Right now is the time to buckle up and really do what we need to do.
Dr. Anthony Fauci is our guest here on the Mike Gallagher Show. You talked about the uniqueness of coronavirus. Can you help explain the uniqueness of this particular novel coronavirus? For example, how do you compare this to the pandemic, the H1N1 pandemic that we went through?
Well, see, the H1N1 pandemic in 2009, which we referred to as the swine flu, was an outbreak. It was a pandemic. It widely disseminated throughout the world, but its impact in the sense of seriousness of the illness that it causes is clearly different. The amount of mortality of that was relatively low, even though it truly was a pandemic and did spread. Right now, we're dealing with something that has multiple characteristics that are concerning. Back way before coronavirus came out, people would always ask me, Dr. Fauci, what keeps you up at night? What worries you the most? And I would always say it would be the emergence of a new infection, likely a virus, that's respiratory borne, that spreads readily from person to person, and has a significant degree of morbidity and mortality. Most of the time, that's influenza. Well, this is a different virus. It's a coronavirus, but it is a virus that's a new virus. It is spreading rapidly among people. We know that just looking at what's going on in the world. And as a matter of fact, from the reports in China, in Italy, in France, in South Korea, in several of the European countries, it is a serious disease. Now, having said that, it's important to point out that most of the people who get infected with this, they can feel ill, a flu-like syndrome, but they will spontaneously recover without any specific type of medical intervention. However, there is a significant degree of morbidity and mortality that's particularly weighted towards those individuals who are the elderly and or those who have underlying conditions, whether they're elderly or not. And that is individuals with heart disease, chronic lung disease, diabetes, immunosuppressive therapy that you might be on for cancer, chemotherapy, or other types of diseases. So the bottom line short answer is that this outbreak that we're experiencing now clearly is worse than what we saw in 2009 with the pandemic swine flu, H1N1.
Dr. Fauci, there's been a debate in New York between the mayor and the governor over shelter in place. We know they're already doing that in the San Francisco Bay Area. In your view, is that a reasonable response to coronavirus to have a sort of heavily advised directive to stay home except for essential trips to the grocery store?
Well, there's interpretations of what you mean by shelter in place. Certainly, the guidelines that we put out from the White House yesterday or the day before, I'm not quite sure. All of these days are melting into one here. I think it was yesterday, clearly say that individuals who are elderly and or those with underlying conditions should essentially self-isolate themselves. And those around them, the healthy young people, should protect those vulnerable people by keeping physical distance from them. In addition, it is strongly recommended that people do not go to restaurants, do not go to bars, do not go to events where there are crowded people. Try and stay, if you're in a social situation, with a group that's no larger than 10 people. In fact, in those areas where there's community spread, it is recommended that the bars and the restaurants and the sports events and things like that should close, as well as the schools in those areas. So essentially, that is somewhat of a shelter in place. It isn't
Sure.
that every single person is doing that, but if you look at the recommendations, it's pretty close to that.
Right. I hope, listen, on a personal note, in the minute we have left, neither one of us are spring chicks. I'm going to be 60 in a little bit. You are the vibrant young age of 79. Are you taking care of yourself? Are you getting lots of rest? Because I see you on TV and being interviewed morning, noon, and night.
Well, I am not getting a lot of rest. I'm of public service. I've made a decision in life that I will have to take that risk. But I exhort all of my co-79-year-olders throughout the country and the world to please go home, self-isolate. If I were in a different position and I had no responsibilities for anything other than just my daily life, I would be doing that. But I cannot do that right now.
Well, millions of us are praying for you, and we thank you for your service, Dr. Fauci, all these many years, and thank you for taking time out of your day to join us on this show again. I know a lot of people around the country appreciate you visiting with us here on the Mike Gallagher Show. All the best, sir.
Thank you very much. Good to be with you.
Thank you very much. Keep fighting the good fight, sir. And wow, what a fight we are in. Dr. Anthony Fauci, director of the